Okay, everyone, welcome. We're going to keep adding people as they come in, and we're about to dive into a lot of great content here. I'll introduce myself in a minute, but otherwise there's just so much to do, and I really want to keep this on time, so I'll be diving in. I do have one of our wonderful practitioners on with us, Shalise, who does functional medicine and nutrition, a lot of virtual appointments, so she can see many people all throughout the US, and then some select in person. And then we also have one of our body workers on, David, who's with us also, and maybe some of our other practitioners will join in. So great. And otherwise, let us know where you're from. So I know there's a lot of patients and general public and some other practitioners on. And sometimes it's always fun to see who's the farthest away. Last night we did a practitioner training and the farthest was Australia. So surprised me. I've seen Colorado now and Vermont. We've got Vermont. So as far as heading east, you win so far. Okay, so let's start diving in here. So just so you know you're in the right place, this is the Depression Sucks webinar. Because depression is not fun and I would not wish it on anyone. I'm very acutely aware of depression because besides all of the professional knowledge I have about it, the education and serving patients, I experienced depression for the first time in my life after a motor vehicle accident and I had a head trauma. So I understand it also from a patient perspective. So I know it's really something tough to deal with. But I hope that at the end, this webinar is going to give you hope because not only do we finally have some new protocols and medical options for depression, but there's new research. Some of what I'm going to share with you is as new and recent as 2 weeks ago. So that's really exciting. Okay, a little bit of a disclaimer, just so you know, this is an educational course, so it doesn't mean we have a doctor-patient relationship. Even if you are a patient on the call, this, like I said, is an educational class. We always do a lot of work to make sure we're giving you accurate, well-informed information, but please do your research and always make sure if you're making any change, you work with, our office, one of the practitioners, your doctor. This is not a do-it-yourself thing. So make sure you work with your team of practitioners and family and friends that love and care for you. Okay, let me show you what we're going to cover tonight. There's a lot on each slide, so be aware. And if you don't know, I sent the slides out. Now, I've never done that before. I've never sent slides to patients before. So if you're on our email list, you got that. And I just think the information is too important. I wanted people to have it beforehand in case they couldn't make it on the call. Of course, we're going to go in much more detail, but I just wanted it to be something you had access to and you could share with family and friends as needed. So hopefully you've had a chance to sort of scan through here, but we're going to go through every single thing on here in the next, let me start my timer. So in the next 50 minutes or so, and also have a live Q&A. Okay, here's a little bit about me. I'm just going to say very little. I like to just sort of put it all on one slide so you can take it in. I'm not shy, so if you have questions, I'm happy to answer them. Let's just save it for the end. I always get the most excited about the content versus talking about myself per se. But as you know, I just shared, I've dealt with depression, and that car accident, by the way, was about 18 years ago. So, it's off and on. I've had periods, I've had long periods of remission, and I've had periods where it was absolutely debilitating and I couldn't do anything, and, everything in between. So I've also, I think, probably tried just about every medical and natural and lifestyle intervention that there is. So really get it from that perspective. As far as a practitioner, my license is as a DC, a doctor of chiropractic, going back way too far now. And I'm the clinical director at Body Love Cafe. So we have many wonderful practitioners, chiropractors, medical doctor, registered dietitian, PhD, acupuncturist. I'm probably going to forget someone, but a lot of wonderful people, and we get to all work together. So anyway, teaching is my favorite thing to do. So let's keep going. All right, so what do we know so far? So a little brain 101. If you've seen the class where I taught it before, brain health, and if you didn't see it, you can go back and watch it. We can put the link to our website. You can watch it anytime. I taught a little bit more about, brain anatomy and how it works. So I'm going to be a bit briefer here because this is really focused on depression. But one of the things I wanted to say about Brain 101, first of all, as much as we know, there's still so much to be discovered. It's sort of like the ocean in that way. It's like one of the last, great topics to really dive into. That, and I would say gut health. We've learned so much and so much still to come. Something you might not know is that the CNS and ENS, what does that mean? CNS stands for Central Nervous System. ENS is enteric nervous system. So CNS is your brain, your spinal cord and all your nerves. Your ENS is your gut. They were actually the same tissue embryologically as you were developing, and then it's split into these two systems. And why do I say that? Because neurons, which are the names for brain cells, if I were to say what areas have the most amount of neurons, brain cells, you would say, well, the brain, right? And you'd be correct. And then if I said what area next, you might say the spine. And then you wouldn't be correct because actually the next area is the gut. So the brain has the most, then the gut, which has between 200 to 600 million neurons, and then the spine and nerves. So we have a lot of neurons and a lot of really wonderful connection between the gut and the brain. It's no longer a theory. We've proven it scientifically, and we continue to learn more all the time. Now, because of that, there's a new medical field that has emerged in the last few years called neurogastroenterology. So looking at the connection between the nervous system and the gut. So wonderful. We've learned about neuroplasticity, and this is the body's ability to regenerate nerves or reroute nerves. So it used to be thought, head trauma, brain lesion, some type of wound or injury, that's it. But now we know that the brain is actually so plastic, and particularly the dendrites, those ends, that they can reroute, make new connections. I honestly could spend the whole class talking about that. So if you like that and you want to geek out, start looking that up. Type 3 diabetes, that's a lay term, but you'll actually see that in published literature. And it has really been deemed to be an accurate term to describe the state leading to dementia and Alzheimer's. Because now we know, and I taught this in the previous brain health class, but now we know that Alzheimer's isn't just, aluminum plaques, amyloid beta plaques in the brain. It's much more complex than that. And part of it is a neurometabolic condition, which means that in the brain still uses fuel, right? And it will use glucose. That's an easy fuel. Some of you are using ketones, right? That's also a clean fuel for the brain. But anyway, when glucose gets too elevated and insulin gets too elevated, and then the insulin receptors downregulate, you get this insulin resistant state in the brain, which is not good. And not only can it lead to some of these conditions I'm talking about, these cognitive conditions, Alzheimer's and dementia, but it really plays a role in depression. So that's part of why I wanted to mention it. So we also know about neuroimmune health. So that used to be a term that didn't even exist, neuroimmune health. What did that mean? Those didn't go together. One of the things we use in our office is LDN, low dose naltrexone. If you've never heard of that, our office is 99.9% natural. So we try to do natural things all the time, but this is one example where we think it's a wise prescription. It's a very low dose, And the real impact is what your body then does with it afterwards. So I'm not really here to talk about the medication per se, but what does your body do? When it gets that, it temporarily blocks the opioid production or the opioid receptors in the brain. And as a result, your body will make more opiates. It will make more receptors and more sensitive receptors. And so what that means is, well, first of all, less pain. But we've learned scientifically that the amount of opiates your brain produces directly impacts your neuroimmune health, which is just about everything. So again, we could do a whole class about that, but this is exciting. And yes, it is related to depression. You're going to hear me talk again about infection and inflammation with depression, which is our next term here, neuroinflammation. So inflammation is a broad term for just about any time something goes wrong in the body. Often inflammation is the sword in the body that, the body's saying, I don't like this, and inflammation can take up space. It can have noxious chemicals. It can, be irritating and grating and turn down or turn up or impact, chemical reactions in the body. And if you're new to talking about the body, we talk about it all the time. Sometimes you forget someone might be, day one. This lovely body of ours, if you've never paid attention to it before, it's essentially like a construction site and plumbing and like an eco forest we share with a bunch of animals. I mean, it's really, an electrical system. It's really fascinating how it works. A chemical factory, all these things could very accurately describe different functions that happen in our body. All right, gut bacteria plays a very important role in the entire body. We've taught many classes on that, and we will continue to do so. In fact, maybe, Shalise, you could share the SIBO link if you are interested in gut health, and especially if you are having some GI issues or you're having a bloating pattern where you wake up, you sort of feel okay, but you start to eat and you get bloating that's worse at the end of the day, then I think you're going to really like that class. Last time we taught it, over 1,000 people signed up for it, about 60% patients in public and 40% practitioners. So our office is really known for its expertise in SIBO. Okay, so gut bacteria hugely impacts the brain. First of all, you make neurotransmitters. Neurotransmitters, we'll talk a little bit more about this, but I'm thinking serotonin and dopamine, norepinephrine, what else am I not thinking of? It'll come to me. But those are the main ones when we're talking about depression. And you just think about them being produced in the brain, but so many of them, a huge percentage, are produced in the gut. In fact, 90 to 95% of your serotonin is produced in your gut, your feel-good hormone. So you can't produce those neurotransmitters properly without having a good gut bacteria. So those are your dysbiosis, or it's out of balance, it's going to be a problem. And neurotransmitters, if you've never heard that term before, think of it as like being a kid and playing a game of telephone, and you whisper from one kid to another. The neurotransmitters are how your brain cells communicate from one to another. Okay, the vagus nerve, cranial nerve 10. So we have 12 cranial nerves, and they're all in our brain, hence cranial nerves. And then we have this one, number 10, and it's called vagus, which is the Latin word for wandering. And the reason it's called wandering is because it leaves the brain. And way back when, they just said, well, this is a wandering nerve. Why is it leaving the brain? Well, we know a lot more about it now. First of all, one on each side, but a little bit different in how they behave and what they actually connect with in your body. But they connect to your heart, most of your organs, definitely innervate your gut. And that vagus nerve is really like a communication highway between your gut and your brain, with about 10% of the communication going from your brain to your gut, and about 90% going from your gut to the brain. By the way, that SIBO guide is a resource that has a shortcut of all the notes, which is wonderful. And then on the Body Love Cafe website, on the video page, is the very detailed video class. So ideally, it works best if you watch it and you have the guide side by side, but however you like it, go for it. Endocannabinoid system, that used to be something we didn't know about either, and some describe as invisible, but we see the impact of it, and we continue to learn about it. You may have heard about CBD. We use, the legal version, we use CBD for pain relief and also for its impact on immune health. And it does so much more than that. So the simplest explanation I could give is when you think of this signal, this electrical signal leaving your brain and going to the rest of your body, the endocannabinoid system plays a role in seeing that signal and communicating back up to the brain. Hey, more, hey, less. So again, a whole nother class in itself. Okay, let's keep going. Let's talk about some emerging and evolving research. I wrote Hello Brain 2021 because this is what's coming out new this year. So first of all, menopause is now being looked at as a endocrinological process, which means it involves your neurological system and your endocrine system. Endocrine means hormone producing. So of course, just in time for me to arrive, what we're discovering in this research article was that when a woman is going into menopause, that there is actually some very, not just typical hormone changes, but other hormones that are being impacted. Blood sugar balancing, insulin resistance is, or insulin is changing, often leading to insulin resistance. And it's changing in the brain, and actually the neurology of the brain is changing. Now, thank goodness, I'm just going to pander to the women here because I am one, but thank God we can multitask, right? So our brain basically figures it out. But, for those of you that have gone through menopause and it's not for the faint of heart, there's many reasons. It's just not a simple sex hormone change. There's a lot more going on. So fun research coming out about that. Multiple sclerosis, some good research coming out. We've been doing some genome mapping. They're discovering that, and it's so funny because I remember working with patients even like 5-6 years ago and talking to them about this. And, I just have to say a lot of times in clinical practice, you're ahead of your time because what it takes to get a research study up and the money for it and the time, sometimes it's lagging. But anyway, we now have the research showing that multiple sclerosis, one of the triggers is a dysregulated immune system, and it's the cells in and out of the brain, and over 233 genetic variants contributing to multiple sclerosis. So interesting research coming out, and of course that will impact how we work with it, and treatment options, and even prevention, and even being able to map out who's more at risk. Microglia, there's some research there. These are specific immune cells in the brain, seeing that they play a role in regulating blood flow in the brain. That was just published in October. Alzheimer's prevention, I say they're catching up slowly here. We've been teaching this for years. But the research is catching up and verifying everything we've been teaching for a lot. Dr. Bredesen's protocol, all of that. So again, another class. Sense of smell is one of your most rapid early warning systems. Some interesting research about the brain and the sense of smell. High intensity and frequency ultrasound, using that as a treatment for essential tremor. So that was some interesting research this year. Meditation, we've known this for a long time, but continuing, they're actually showing, they did a study, appropriate, well laid out study, that those who were meditating versus the control had less cortisol in their hair analysis. Germany put out a study this year looking at antibodies and vaccine potentials for Alzheimer's in mice. So lots of interesting things happening. And I just wanted to show you that the brain research is continuing. This is new stuff I wanted to share. Okay, so let's start diving into depression and just narrow this down really specific for you or your loved one or your patients or whatever brought you to today's call. First of all, depression is rampant. And sometimes it's transitory and it might be not a true depression. It might be situational. Not that it doesn't, feel miserable. It does. But true depression, you need to have symptoms for 2 weeks or more that persist. Typical symptoms: lack of joy, including activities that you would normally find pleasurable. About 17 million adults and 3.2 million teens in the US with a diagnosis of major depressive disorder. So there's different types of depression. Very common but serious mood disorder. It can be life-threatening, which is why I want to share as much information with you as I can, and up front and in advance and after the fact, and make it easy. The other problem with depression, especially when we're talking about kids, and I don't want you to always take depression seriously, whether it's you or a family member, because it is life-threatening, is it can change the brain over time. So traumatic brain injuries do this also, but the more depressive episodes you have, first of all, if you have one, unfortunately, you have a high percentage of having another. If you've had two, then it's like a 67 to 80% chance you're going to have a third. It's just not fun. But the more time a brain is spent depressed, the more that brain is actually going to change. The physiology and the function and the wiring of the brain, but even the structure and the volume and mass. I mean, it's incredible what can happen. Depression is not good for the brain. Okay, it's not good for us, and it's just not good for our body. Another thing I want to mention, I didn't put in the notes here, but since I brought up children, is to always take this very seriously because it is life-threatening. And I don't want to generalize between men or women because there's always exceptions, but sometimes one gender versus the other, if there's a suicidal attempt, it's always a cry for help. But sometimes people will, if someone's getting an error message, we'll make sure we figure out how to get that. I'll look it up. Ask me in the Q&A and I'll get that link for you again. Or you can get on the FMA website. So it's on the FMA website, Shalise, under resources, if you want to grab it there. Okay, so unfortunately, sometimes this impulse, because, it's miserable. I know suicide is awful, and the people who suffer the most are the ones who are left behind. And sometimes, you're very angry and it's hard to have compassion for the person who's gone, but the person who's gone was really in a lot of pain and very sick, quite honestly. They weren't trying to be selfish, even though it may have ruined your life or a child's life. But when someone is in that state, and especially I'm thinking of like teen boys, they're more likely to take an impulsive action and then it's game over. So that's why this is a very serious, important thing to be paying attention to. Also, there's some medications, including common, like singular, over-the-counter allergy medications that have been known, they have an FDA black box warning on it, and can create suicidal ideation in children. So we just really have to watch those things. So just a little side note there, but how important this topic is. Okay, so depression as a whole can absolutely be a symptom of something else. It's a condition, it's an illness, it could be from an injury, but it could also, depression could be just a symptom, a very miserable one, of a traumatic brain injury or a structural change or a brain lesion, an inflammatory condition, immune condition, even diabetes or a virus. Or something else psychological. So we have to keep that in mind, because sometimes people think, oh, I just have depression. They're going to go entirely after depression. They don't realize they keep having depression because there's something contributing to it, and they're not getting to the root cause. The classic the classic diagnosis definition I gave you, symptoms 2 weeks or more, can impact work, home, diet, sleep, family, really everything. Okay, here's common signs and symptoms. So from debilitating to high functioning. So that's another thing is, you know, if someone is in bed all the time or suicidal and we need to call 911, it can be very obvious that they're dealing with depression. There's other people who are extremely high functioning in society, and unless you were good friends with them and knew them behind the scenes, you would never know that they haven't been happy in 3 decades. So, you know, getting curious about family and friends, this is a conversation we need to be having all the time. Just like, you know, if I'm talking about gut health, I want to normalize talking about poop. There's nothing wrong about that. We need to talk about it. And I want to normalize talking about mental health, because just like someone might have cancer and they're doing a holistic treatment, or they're doing chemotherapy or whatever they need, or someone has heart disease, someone can have a brain illness, and depression is just a brain illness. There should be zero stigma behind it. Okay, classic versus current theory. So the classic theory is biochemical. You're just lacking these neurotransmitters at a brain level. And then there's a physiological theory, many of them: family dynamics, conditioning, learned helplessness, trauma, et cetera, et cetera. And then our current understanding is much more complex. And thankfully, this current understanding is translating even into like, you know, it's hard to see yourself, you're like, messy hair. But this current understanding is even like National Institute of Health. And so it's starting to show up in these very conventional places, very mainstream medical. So that's good. They're recognizing it's a complex condition. It can involve any or all of these. So I hope you really hear this. Genetics, biochemicals, gut bacteria, immune health, neuroinflammation, infections, toxins, conditioning, trauma, personality, medications, medical problems, faulty mood regulation. Not that you have a character flaw, literally, there's a physiological reason for it. Injury. So again, let's end the stigma. Okay, what's new on the horizon? These are some things you might not have heard of. First of all, these are emerging and in progress. It's not something you can just, you know, go to Kaiser or John Muir ask for this. We're seeing biomarkers. So these were identified at UC Berkeley. So a lot of this was sort of local, which was neat to see. I'm in the Bay Area, so way to go, Bay Area, California. So they're looking at genes and pathways associated with depression and lack of motivation. And the lateral habenula was turned up if someone had chronic stress. I don't know about any of you, if you had any stress over the last 18 months, or maybe it was just me. But chronic stress, and it could be like a moment of big stress, or it could be ongoing, like a bad relationship or a bad job, or you know, many of the colleagues I work with and teach, by the time they finished medical school and residency, I mean, come on, that's a lot of stress that they went through. Very, very long time. So anyway, any of these things can turn up dysfunction in this specific area of the brain and reduce motivation. And the lateral habenula impacts dopamine and serotonin. And this was actually a study that looked at it and isolated it from some of the other reasons and factors that are involved in depression. So that was really interesting. And some of these biomarkers, they lead to some of this other research I'm going to share with you. Okay, SAINT is an acronym, Stanford Accelerated Intelligent Neuromodulation Therapy. I don't know why they called it that, but it's basically intensive individualized TMS. So we're going to talk about TMS, transcranial magnetic stimulation. So this SAINT, this new system, is like TMS on steroids. They had 70% remission within days that lasted for months, and that's quite good. This was a new research article, October 2021. It's still in its experimental stage, and it's different from the current TMS. So I'm going to show you how long current TMS takes. But that would be great to have, you know, be able to go in for a much shorter session and get a longer lasting response. And it's non-invasive. So when I describe TMS, it's similar to that. So we're getting there. A customized pacemaker for the brain. Now that's definitely invasive, but they just had success. The first one, so this is a new study published October 21 out of UCSF. And they did it for one woman. I'm trying to remember what her name was. Was it Sandy? I don't remember. I'd have to look it back up. But very severe treatment resistant major depressive disorder for a long time. And they used this new biomarker science. It was very specific to what area in her brain was triggering the depression. And then they placed almost like a little device, like a pacemaker with two different leads. And it would give these electric pulses, very personalized to her. And she had near immediate relief, which is fascinating. And she's a local. And the results have lasted 15 months so far, but this is a study with one person. So we'll see where they go with it. So that's what's on the horizon though. All right, here's some things available now, or possibly you can get in clinical study. And again, some things you might not be familiar with. I want to share these with you because depression, part of what makes it so unique is that I can't say to you, this medication or this natural protocol, you're depressed, go do it. That's going to work for everyone. It doesn't work that way. And not only does it not work that way, because there's so many different reasons why someone feels depressed and so many different mechanisms, but even someone who may have taken, let's say they took an antidepressant, it worked for them for 2 decades. Some of you know what I'm talking about. And then all of a sudden it stopped working. So even the same person can have something that works for them and then doesn't work for them. So it's really a tough condition. Okay, so TMS, that's the transcranial magnetic stimulation I told you about. I've done this personally. I've referred patients. It's non-invasive. It's almost, it sounds a little bit like an MRI when you get it. It's used for depression and anxiety, FDA approved. It's a pain because you have to go daily for 6 weeks, and it's expensive, so you want to get insurance to cover it. About 50% improve and about 30% go into full remission. My personal experience, I don't know that anyone's interested in that. Again, some people have amazing stories with it. I found it helpful in the beginning and then not so much long-term. Doesn't mean I wouldn't try it again. It was years ago. It's probably improved. But for a non-invasive option, something that you can try. And we have a local, he also does remote sessions, but we have a local psychiatrist who's wonderful that I will send patients to who need a prescription for that. All right, ketamine and esketamines. You might not know about this either. Now, I'm not recommending this street drug, right? This is not a do-it-yourself class, okay? But there's a lot of research and ongoing research into ketamine for depression. Now, it is a, what's it called? Anesthesia. And it's used all around the world. And sometimes it's used with animals, it's used with kids. It's sort of a light, somewhat easy anesthesia. And the questions, by the way, put them in. Shalise is going to grab them and we're going to go through them all at the end. And you can ask questions at the end too. But if you think of a question, absolutely type that in so you get it out while you're thinking about it. Okay, so ketamine, let's see, how long has it been around? Maybe 6 years. I don't remember the exact, no, longer than 6 years. But you would go and get an infusion, and it can be very expensive. You can still go and get infusion, so an IV. The thing that's fascinating about ketamine is it is particularly effective if people have suicidal ideation, so suicidal thoughts. And by the way, all these years being depressed, there was one period of time where I experienced that. And I can tell you it's awful. I had, in fact, there was a post just the other day, someone said, someone who was suffering from depression said, oh, my family said to me, what's wrong with you? You have nothing to be depressed about. That is the worst thing you could say to everyone, to anyone dealing with it. So don't do that. That's awful. But I will tell you, as someone who was in that state, I didn't have anything to be depressed about at the moment. I really didn't. I was very happy and I had a lot to lose. My life was very full. and joyful. And I had a lovely young child as a single mom. Because of what was going on with my health, I experienced suicidal ideation every minute of every day for 18 months straight. It's the worst. So your brain can absolutely have thoughts that you don't want to have. And there's physiological reasons for it, and you can get help for it so you don't have it anymore. But it's very important because some people are going to take action on that, because when they're in it, they don't know that, like, they could feel miserable on Thursday and by Friday they could feel different. And that's one thing about suicide that makes it so tragic, is there is help. And I just hate it when someone doesn't get the help they deserve. So ketamine is one of those things that can be miraculous and get rid of suicidal ideation within hours, where some of our, antidepressants that we've been working for forever might take weeks or months to work. So this is a big deal. And then the FDA approved, I think about 2 years ago, a nasal spray, much lighter dose than the infusion. You can just get it at home. I know about 5 compounding pharmacies within the Bay Area that will produce it. Now they also have troches and lozenges. I've used that also. It tastes disgusting, I can tell you. It works. It's a little wacky and weird. It's something you should use with someone. I'm not a drug person, so I'm pretty lightweight. I'm sure other people don't have a reaction, but I can walk by a donut shop and gain 5 pounds, or I can take CBD with no psychotropic reaction and feel high. So I'm very lightweight, or, one sip of wine and I'll be drunk type of thing. So I don't really like to use any drugs at all, but I have tried the ketamine. It is very effective, but like I said, not do it yourself. Make sure you have a proper prescription. And then I think you should either use it in a clinical setting, or if you've been prescribed to use it at home, have someone with you. But it's very short-lived. Even that weird reaction I'm describing is short-lived. So there was a study in April of this year, or not a study, the National Mental Health Association, or NHI, but for mental health, gave 8 grants to look into new ways to lower suicidal ideation, including using ketamine and TMS. I don't know if you're aware, but with everything everyone's been going through the last 18 months, depression has soared. Let's see, what else was I going to say about it? There was a research article that came out in April, I want to say, of 2019, that looked at TMS and ketamine together and found out when the two were used together. Now, I never did that, but when the two were used together, that they had better, longer lasting results. So you might want to talk to your doc about that. All right, psilocybin, new player, in the medical field. You might have been playing yourself for a long time. I can't comment on that. Like I said, I'm really not a drug person, and this isn't a do-it-yourself. But there is some good research showing that psilocybin, this is an ingredient, if you don't know, in magic mushrooms. So I'm not saying like go down the street and, score some acid or pull some mushrooms from your backyard. They're probably poisonous and you're going to die. Don't do any of that, okay? I'm a big fan of things that are, in a laboratory and you know exactly what you're getting, okay? And legal. I think legal is a good idea. Okay, so anyway, it's a candidate. Psilocybin is a candidate for treatment-resistant depression. There was a study in the New England Journal of Medicine that came out in April of this year that it is as effective as common antidepressants. There's almost 30 clinical trials running right now related to psilocybin and depression. JAMA Psychiatry put a study out in 2020 that showed psilocybin was 400% more effective than antidepressants. And then keep in mind, like I said, clinical preparation and administration. It's not a do it yourself. And right now there's a company that makes psilocybin in capsules, and it's still, I don't think you can get it over the counter yet. I could be wrong, so ask your doc. Again, this is really, really new, but they're doing research where it's administered in a medical setting. It takes about an hour. They're doing psilocybin, and you're listening to like happy music. I mean, it's a whole experience, but the benefits for depression has been amazing. And there's a new company right now in phase 2 clinical trials, I think going into phase 3 in January. So this is exciting. And they have a patent version because, again, I've never played with this, but some people have very negative reaction and GI issues and side effects using psilocybin. So this company created a patent version that has much less side effects, and it doesn't have to go through your digestive system. It doesn't have to go through your liver. It's almost like, you know, those little Listerine strips that melt on your tongue? It's like that. It's a little film. I think this one goes under your tongue, but much less side effects, supposedly much more effective, and rapidly get the benefit. So let's see what happens there. Fingers crossed. I'm for anything that will help people with depression, right? And then brain mapping, UCSF, the Epilepsy Center, they've been using biomarkers with brain mapping to stimulate and target the orbitofrontal cortex, OFC. So basically, there's a lot going on. That's what I wanted to show you. Good news coming up. Okay, what do we typically do? We prescribe medications if you're going to see your MD or your primary care physician or your psychiatrist or John Muir or Kaiser or your local HMO. And it's typically trial and error because they haven't had a good mechanism to look at you and say, this is what will be best for you. But it's coming. That's part of the biomarkers. That's part of the mapping. And now we even have more. I'll tell you in a second here. Antidepressants, the most common, like, you know, if I was in school teaching a bunch of psychiatrists, someone comes in, says they're depressed, this is step 1, they'd give them an SSRI, selective serotonin reuptake inhibitor. So what it does is it stops the, you know, between the neurons as they're talking with those neurotransmitters, it stops it from using up the serotonin as much and makes it more readily available. Or they do an SNRI, norepinephrine reuptake inhibitor. And for some people, it works beautifully. Others, it makes them feel worse. Some people get no relief at all. So about 30% of major depressive disorder doesn't get any relief. Antidepressants, like all medications, have side effects and consequences. But I'm not being negative about it because I'm telling you, the #1 task for depression is to get some relief immediately, right? Because it's a life-threatening issue. And, you know, your doc has to weigh like the side effects and the benefits and all those things. But you want relief first so you're not in danger anymore. And then you start fine-tuning it. You work with your physician, your functional med doc, your psychotherapist, your support group. A lot of this is guesswork. And I sort of gave you, you know, some people say it's amazing, it's life-changing. Others say it's numbing. I don't feel like myself. It barely took the edge off. It made it worse. I was depressed before, but now I feel suicidal. Some of the antidepressants actually worsen suicidal ideation or create it, particularly under the age of 25. So that's really a challenge. Or there was no response, or they gained a lot of weight, too many side effects. Now we're starting to see some blood testing, some proteins, some genetic testing, looking at your SNPs. There's a few we test for in our office that show someone is more prone to be depressed or have anxiety or, you know, breast cancer risk or heart disease risk. It's really fascinating. And brain scans and mapping. So some of it's usable right now and it's continuing to evolve. And in 2020, they used artificial intelligence to read EEGs and to be able to predict the patient what the best antidepressant medication was. So I love that even conventional medicine is really moving towards the specificity. It's very much needed. Some prescription medications that are older and might not be on your radar are MAOIs, monoamine oxidase inhibitors. And they're not used as much due to some dietary restrictions and side effects, but they can be very effective, especially for treatment-resistant depression, and something that should be tried before someone does ECTs. So that's to, you know, if someone is facing electroconvulsive therapy for severe, you know, non-retractable depression, they might want to ask their doctor about an MAOI first. And you have to have a washout period. You can't like just take them back to back. So again, work with your physician. Some other older options are tricyclic, TCAs, atypicals, lithium, antipsychotic, or other meds for off-label use. Some psychiatrists will use Ritalin, a stimulant, methylphenidate for someone who's depressed. So they get very creative. And then antidepressant medicines typically impact dopamine, norepinephrine, serotonin. And then there's non-meds, in the medical treatment, TMS, which you already mentioned, ECT, electroconvulsive therapy, hospitalization, traditional therapy. All right, let's talk about some creative and holistic protocols. Some people use one or the other. Some people need all of them, okay? Or they use one for a period of time and then they move into the other. So inflammation and insulin resistance, addressing it. And for my natural practitioners who are listening in, because you want to be able to work with your patients better, please add these protocols and consider this when you're working with them. So you can see I just took this quote so you can see it. Largest ever study of depression and inflammation published this year, American Journal of Psychiatry, definitely confirmed a link between inflammation and depression. They found people with depression had more inflammation than those without it. Medications or natural means to lower inflammation can be very helpful. Lifestyle changes. Also, what we found in 2021 is insulin resistance, like a pre-diabetic patient, doubles the risk of depression. Okay, so hopefully that's tying together with what I told you at the very beginning, that insulin resistant state in the brain. I listed some actual supplements here. We use Designs for Health. Can you share the Designs for Health link? Body Love Cafe actually has 20% off right now, which doesn't typically happen. It's a Black Friday sale. So you have to have a special code, but Shalise will give it to you. Again, please work with your practitioner and, don't make changes to your diet, exercise, supplementation without consulting, right? You always want to be safe first and foremost. But I did want to give you some names that you could at least be looking into. This is not an exhaustive list, but these are some good things for inflammation and insulin resistance. So inflammation, SPM Supreme, you might not know about that. Specialized pro-mediating factors. This is looking at sort of downstream inflammation. Cannab PEA, I love this. This is a very fascinating capsule. Half of it is a powder and half of it is a liquid. I mean, you just swallow it at one, but just even look at it, you're thinking, what's going on in here? I could talk a lot about that, but you're getting CBD, cannabinoids from full spectrum hemp paired with PEA. PEA works for injury, even helpful in endometriosis, inflammation, many different mechanisms. So all in one. Phosphatidylserine, great. I use it for the brain all the time. Brain support. It is also very helpful in lowering the cortisol response. Omega-3 fats, about half of all Americans are going to be low in omega-3 fats. So I listed a couple. Omega Vale smoothie. The mango is the one that I think tastes the best and has the best fat profile. So children will have that, but if you like a liquid, that's a good tasting one. And then Omega Vale Hypo or Omega Vale TG1000. You don't need all of them. I just want to give you options, right? So one's a liquid that tastes good. One, you take 1 capsule a day. The other one, you take 2 capsules a day. So options, but these are very good, either emulsified omegas or triglyceride, highly bioavailable, good quality source. I don't work for Designs for Health. I was talking to some Designs for Health practitioners last night, and I told them I've had this happen before where if I was referring something and the company changed how they made it or they weren't doing a good job, I'm not going to use them anymore. I'd switch to someone else. So I always recommend really best top quality supplements because quite frankly, we have to get results, right? Now that was for inflammation. So here is for insulin resistance. Glucose Supreme Herbal, really excellent blend of herbs. Always, make sure you don't have any contraindications, but excellent blend of herbs for maintaining and lowering blood sugar. So effective that when I have diabetic patients, I'm always saying, please stay in communication with your prescribing physician. Please monitor your blood sugar every day, because if you're going to take this works so well, you don't want to be in a point where your blood sugar goes too low, right? So you need to pay attention. It's that effective. Metabolic synergy, some good nutrients and vitamins to maintain blood sugar, weight loss support packets, myosynatol, so quite a few options there. Hopefully that's helpful for patients and practitioners. Okay, home devices. So more along creative and holistic. Again, some things you might not know of. And these are available right now. One, in fact, we give a steep discount for it on our site. We don't make it or anything. We just get it from them and are able to pass on the savings to you. So they're able to give us savings. But it's a cranial electrotherapy stimulation device. So, you know, 1,000 times lower dose than ECT. I've used it before. It almost feels like a TENS unit, but it just has a little band that goes around and these little pads. Very effective and FDA cleared for depression, anxiety, and insomnia. So I think it's a great device, honestly. Light therapy, I have one right here by me. You can get it on Amazon. I recommend a 10,000 lux lamp, and I think it's a good idea. You don't need to be depressed to use it. I think it's a great idea for fall and winter, and we're getting less light. The key for that is you want that light to hit your eyes, not staring into it, but maybe while you eat your breakfast or you're doing something else, have it just to the left of you. So you're looking forward, doing whatever you're doing, but the light is shining at you. HRV, heart rate variability devices that can help you improve your stress and anxiety and have an indirect impact on depression. And then lifestyle changes, diet. And I gave some examples of some diet things, but it really has to be customized. That's one of the things Shalise is so brilliant at too. Seriously, with all of her registered dietitians, she went to UC Davis, has a very strong medical education, has a very strong family holistic background, raised very healthy, has a functional medicine education. I mean, she's got a lot she can blend in there. So not one diet for everyone, but certainly diet can be huge for depression. Exercise, anything will help, but if you can do HIIT, high intensity interval training, that has been shown to be the most effective. Getting out in nature, hiking is all good. I listed a few supplements, not an exhaustive list, but B vitamins can be very helpful. 5-HTP, precursor to serotonin, omega-3 fats, we already mentioned. Some herbs, St. John's wort, Squalene torchicum. Now, if you were going to get that like from Designs for Health, that's called mood stasis. I know it's like, what a weird name. It's an old African bush, and it's very relaxing and used often in the evenings to sort of wind down. Lithium orotate, which can sound scary. In Designs for Health, it's called lithium synergy, but very effective, especially for people who have trauma and emotional outbursts. It's not, you know, lithium is essentially salt. So it's the same type of mechanism as someone doing prescription lithium, but that is made in the lab. It's there's other ingredients. It's a much higher dose. You're going to see side effects. Lithium orotate, very low dose, very natural. And they actually have interesting research that communities that had lithium orotate in the water, in the municipal water, had less crime than cities that didn't. Kava, skullcap, saffron. So again, anytime you use herbs, these are brilliant and powerful, and a lot of medications originate from herbs. Just make sure, like St. John's wort, for example, excellent herb, but one of the ones that have the highest interactions or contraindications with other medications. So if you're on medication, please ask our office or the practitioner you're working with or your physician is prescribing, you know, make sure you can take it. Meditation, we already talked a bit about that. Structure and routine, sleep hygiene, stress management. This is part of what makes depression so hard, is because it requires so much of the patient in order to get well, and it's exactly at a point where they don't feel capable of doing anything. So I've taught classes before. You can see them recorded, and you can also go to our website and go all the way back to some of our original articles. It's on the video tab. Go all the way back, and you'll see an article called Road to Recovery. I highly recommend reading that. It really goes into detail about the lifestyle and natural and practical things you need to do, and some of the things that are hard, because one loving person cannot save someone who has depression. What will happen instead is they will both drown. That's just the truth. And I say that as someone who's been on both sides of that equation. Depression sucks. So when someone is really depressed, they need a team, because it's too much for one person to carry by themselves. Okay, let's keep going. We'll get towards the end. We're going to do our Q&A. Holistic or psychosocial. These are things you want to address because these are other true physical reasons, right, that cause depression or cause the symptoms of depression. So this is like the woman who goes in and she has every symptom of hypothyroidism, but she gets ignored, told she's just depressed, and given an antidepressant. Now, she might need an antidepressant, I don't know, but she had all these other symptoms, and the root cause was hypothyroidism. What she definitely needs is to have her thyroid issues addressed. So I just want to say testing. We do a lot of testing in our office. Highly recommend you. In fact, there's 10% off labs right now. Sorry, someone's going to watch this later on. It's just for this time why I'm teaching it. Sorry. It's just a unique Black Friday thing that they have 10% off labs and 20% off supplements. So sorry for the people down the road. But testing, I highly, highly recommend it. Addressing hypo or hyperthyroidism, hypo or hypercortisol issues. It could be functional. It doesn't have to be a disease. It doesn't have to be Cushing's or Addison's. Could be a big stressful thing that just happened to you, or low ongoing stress. Anyway, my favorite test for that is the Dutch test. Maybe Shalice could tell you a little bit about it. There could be a sex hormone imbalance. You could be in perimenopause or menopause. It could be perinatal, right? Some people find their depression is relieved while they're pregnant, or they never had depression in their life, but they got depression right afterwards, postpartum. So, really these hormone changes are big. Gut health, we talked a bit about that. Dysbiosis, candida, a yeast overgrowth, SIBO, a bacterial overgrowth. People who are constipated, more likely to be depressed. You gotta get that stuff out. Immune health and infection, allergy issues. I always know if I'm getting a virus because I don't like my husband when I'm getting a virus. And I love my husband, he's a sweetheart. But if all of a sudden I really don't like him, it's the weirdest thing, I'm like, I'm about to get sick. And it's the inflammation, it impacts my brain, maybe because of the traumatic brain injury. I don't know, that's an unusual thing, but it's a tell that I've seen in myself and I've seen it in other patients. And it's just, he would tell you himself, it's happened over and over again. You just always know, can't miss it. Okay, metabolic health, we talked about that, blood sugar, inflammation, sleep issues. If someone has sleep issues, that can be a root cause contributing to depression. And by the way, if these things aren't addressed, what is likely to be on the horizon? I can't say 100%, you might be unique, but what is likely to be on the horizon is dementia and Alzheimer's, which sucks. So, try to deal with stuff ahead of time if you can. There could be structural issues. You could have had a head trauma. That was what happened to me. You could have had some other injury, or football player or soccer player or something like that. And there could be an actual brain lesion or a bruising, a hematoma, something that is contributing to depression. And then there's psychosocial and behavioral. We have a psychotherapist as a member of our team. So psychotherapy can be very helpful. And again, you often have to pair it. Yes, concussions for sure. I was just talking with another doctor, and I've talked about this when I've taught before. It was a different subject, but there's a website called Pink Concussions. And it's a good thing we're talking more about like men playing football and these, closed head injuries and the long-term sequelae of it. But actually, if you want to know facts, women get more concussions and have worse long-term sequelae than men, but people don't talk about it. And there's many reasons for it. Part of it could just be structure. Our necks aren't quite as stable, less musculature. But anyway, pink concussions, go find some research there. It's fascinating. Okay, behavioral skills. So I was trying to say someone might need psychotherapy, CBT, cognitive behavioral therapy can be very effective. They might need to do some meditation. They might need an antidepressant, maybe hopefully only short term, some natural means. That might be their package. Someone else, maybe they don't need a medication, but they got a prescription for TMS and some ketamine, and that got them out of their first big crisis. And then maybe they were able to do some natural means to sort of sustain wellness while they worked with a health coach and a support group in order to pull some weight off and create a structure and get some regular exercise. So it really is unique for everyone. Let's see, I gave you many things: hypnosis, dealing with trauma, PTSD. There's, again, very interesting research. Is something we work with in our office, and even a test you could take. You can do it in our office, you can do it online. If you want to look at ACE, Adverse Childhood Experiences. So that study looked at the number of childhood experiences that someone had, right, out of their control. And very unfortunate that we can't protect kids from that. But the truth is, very few kids get out of childhood without some bump along the way, right? Even a divorce, just a simple divorce, is traumatic for a kid. And then unfortunately, some children experience much more trauma than that, right? But the number of adverse childhood experiences was actually very much correlated to their health issues later in life. And PTSD and even complex PTSD. There's outpatient or day programs for some of the most serious cases. I've referred some patients to John Muir, and I know there's other ones around here. Sorry, I'm not saying some of the other names, but John Muir has like a day program. Road to Recovery, I mentioned. Maybe we can share, maybe David could share that exact link, the Road to Recovery. And then let me just mention the survival plan. I think this is really helpful, not just as a patient, but also for practitioners. And we would do this a lot more with our patients dealing with bipolar, because with bipolar, it's different. You could have a very, very deep depressive period, but you could also be manic, right? And have this very manic phase, which sounds good and they enjoy, but can be hugely destructive in their life and their family and their work. So it's really this spectrum of extremes that this person can shift from. Again, physiological reasons. So you could do this with anything, including depression and someone who's suicidal. But I think with bipolar patients, it's particularly helpful. And when someone's in a well state, what we would do is I would have them write it themselves. And sometimes we just did it together in a visit. And they would write, what was their slippery slope? Was it that they went to bed at 10 every night and then all of a sudden they started going back at 11? Sounds like not that big of a deal. Maybe that was step one. And then maybe the next thing was they just started skipping breakfast. They know they need like a good protein breakfast, but they just started skipping breakfast. And then maybe the next thing was, they stopped showering. It goes all the way down to they felt suicidal, but it starts at this tiny thing. So on one side, they would write that thing, and then they would write what should be done to help them. So if it was, they were supposed to go to bed at 10, they start going to bed at 11, maybe they needed their partner, to harass them and get them into bed. Maybe they needed an accountability buddy outside of their family. So whatever it was, they wrote it in their handwriting all the way down. They wrote who their treating doctors were. They wrote if they were on any medication or natural remedies. They just put everything sort of on one sheet. And then I said 3 sources because they gave 3 copies out to people they trusted. And it might have been their partner, or the partner might not have been a safe person, actually. Maybe it was a best friend, and maybe it was their psychiatrist. But 3 different people on their team had this, so that if they started slipping, they could help them. And it was particularly important when people were in a bad state, and then they're not really receptive, that they could see something written in their own handwriting. And then they were more likely. So especially when I think of some people where they were getting to either a suicidal state, heavily depressed, or a manic state, and they're like heading to Vegas and gambling it all, that they saw in their own handwriting, I need to be hospitalized, because some people need that. And then instead of feeling like something was done to them, it was like, oh, I wrote this down, I'm at this level, I need this help, and I'm going to move past it. So I sort of covered the tiniest little thing to the biggest extreme, but hopefully you get the idea. And I think it's something that's worked well. Okay, what's next? Options for support. First of all, we have lots of free recordings, some for patients, some for practitioners, so please take advantage of that. Most of the stuff for patients are on our Body Love Cafe website, but sometimes you're going to see something there for practitioners also. Thank you guys. Appreciate the feedback in the chat box. So lovely. And then the Functional Medicine Academy website is where you'll see a lot of the practitioner stuff. Individual support, if you're a patient at Body Love Cafe, you know how to find us, or if you aren't and you want to be, or just learn more, you're welcome to do a 15-minute consult. If you're a practitioner and you want to learn more about how to help your patients, just go to FMA and check it out. Remember, reach out. It doesn't have to be us. Reach out to your local person, reach out to your primary care physician, talk to your psychiatrist. Don't be afraid to ask for help. Call a suicide hotline or 911, because with depression, the rule is you live to fight another day. Okay, that's always the rule. Functional Medicine Academy classes, if you have questions about that, just ask me. There's a 15-minute consult for Body Love Cafe. There's the link, tiny URL, FMA class, if you want to see sort of what those classes are like. This sort of shows them to you. If you can imagine how much detail I do in an hour, imagine spending a whole Saturday with me. This is for practitioners or students, nutritional professionals, anyone who really wants to geek out and go deep here. All right, let's get some questions answered. I know we had some come up, and I want to make sure I'm respectful of everyone's time. Shalise, do you have any that you saw?
Yep, I have a few for you.
Okay, great.
All right, so question number 1 is CBD/THC helpful for anxiety and depression, or is it hurtful?
Yes and yes. Okay, so it depends on the person. Some people very helpful and they'll swear by it. Even like ADHD, I know some people who have used it with ADHD and it helps them, and other ones it makes it a million times worse and they're an absolute zombie. So it is just very customized. Some people, and you usually, if it doesn't work, usually know right away. The negative reactions tend to show up even faster than the positive reactions. So some people with CBD, it works really well, but then there's a few where they take it and they can get, especially with THC, like if you're really getting some THC here and using an actual cannabis product, you can get a rebound anxiety. That's awful. Like, I'm not someone who can use it. I am not at all against anyone using it, but I remember I tried one, I don't know, a couple of years ago, some tiny little edible, and I'm super lightweight, but the anxiety, I felt like I wanted to go running down the street. It was crazy. Other people, mellows them out. They love it. It works beautifully. So as far as like an herb or a plant, if it works for you, great. Use it responsibly. Make sure your healthcare practitioners know about it, but everyone's going to have a unique response. So having it be part of, your toolbox, sure. If you're a practitioner and you're recommending it to other people or you're talking to family, it's one of the things to look into. But just don't be surprised if it doesn't work for someone. That's okay. Move on to the next thing.
Yeah, I also find that the quality of the hemp or CBD that you're using is super important.
Absolutely.
You have to make sure you're getting it from a reputable source.
We just had a conversation actually about this in our team meeting with our MD who works in hospital environment a lot with breast health and would see men with, enlarged breasts.
Gynecomastia.
So you may get some side effects you don't want.
Yeah, I agree, Dr. Z. It's really important to know where you're getting your hemp from. And if you've used hemp in the past and had maybe not a great experience with it, there's so many different strains of hemp that it's important to know and work with someone who knows what they're talking about and what you're trying to accomplish with it. Okay, let me get you your next question, Dr. Zachary.
I saw one. Let me answer one real quick while you're looking. Oh, the adverse childhood experiences. Yes, we have a service in our office with the letters ACE, so it can be confusing. So I think Shali's got that already. TBI versus ACE, two totally different things.
So our next question is also about hemp and CBD, and it's asking, is CBD or THC contraindicated with most antidepressants or medications? The specific medication the person was asking about was, I have to say this, Lamictal.
Oh, Lamictal.
Yeah, which is the anti-seizure, anticonvulsant medication.
I don't know of a specific contraindication, but I would look it up. We have a couple different websites where we look it up, and I would also ask your prescribing doc. They're gonna pull up another database to check. You can look at Hippocrates online and look it up for yourself. So Lamictal, just so you know, is an anti-seizure medication, but a lot of psychiatrists may use that for depression or anxiety or ruminating thoughts or OCD, those types of things. And some people feel fine on it. Others, they might feel a little too numb, like a little too, like the whole brain is sort of muted, but it basically sort of dampens a bit electrical firing. Like if there was, and that's why it's an anti-seizure. So I'm gonna have to describe this backwards, but really in epilepsy or these kinds of situations, your threshold to fire gets lower, which means less stimulus would make you fire. Lamictal raises that threshold, so you're less likely to fire. So for some people, it can be helpful. It is a prescription, so you're gonna wanna do it with your prescribing doc, but I can't think of, off the top of my head, a specific contraindication, so I'd look it up.
Great, thank you. The next question I have is about the difference between bipolar disorder and depression. And this person asked whether or not those are treated the same way, kind of what is the approach for those and how would you look at them differently?
So it's a great question, and you really have to, with a patient who's experiencing bipolar, you really have to be mindful of it, because even some of the natural herbs and remedies that you would use for depression might not work for a bipolar patient. If they're in depression, it could help pull them out of it, but if it swings them into a manic state, that's not good either. So again, this balance and this titrating and, maybe starting at a much lower dose or using a different option altogether. So, because they can swing between both states, we can't say like, it's like when you're working with the gut, you can't separate that it's all connected. So we can't say like, let's just treat the depression here, and then later, let's just treat the mania here. And it depends on if they're a rapid cycler or not, or maybe they go through long periods where they're just in one state. So it depends. Often you'll see an antidepressant used, maybe an antipsychotic, or some other atypical. Lithium is really, used a lot, but some people don't tolerate it well and don't like it. So Yeah, it just depends on the individual. From a natural standpoint, I've seen a lot of really good response with sort of mood stasis and lithium orotate, a blend, and just really being mindful, low dose between the two to sort of maintain that balance, and a more frequent communication with the patient and the practitioner, more frequent monitoring with all the health professionals, and a more regimented lifestyle routine for sure. Someone's saying THC is death to bipolars, it fuels cycling. It can. Everyone's a little bit different though. I mean, I'll tell you, if you see enough people, you experience something where I gave that example of ADHD, and you're like, every time it works this way, then when you get someone and it works differently for them. So that's why I just like to leave that space there for the exception. If you're the exception, you're not a freak, okay? You're just the exception. It's okay. What is the SNP for TBI? That's an interesting question. There's not a direct SNP that I know of. So SNP is NSP. It stands for single nucleotide polymorphism. We're still learning more about them, but you can, map out your genetics, and we have certain tests that we like to use. And there's probably about 10 to 15 SNPs that are really clinically helpful. And then, you start moving a little bit farther out, and then there's some that are helpful. And then, a lot where we just still have a lot to learn about. So there's not a specific one that I can think of that would make you more prone, because traumatic brain injury is an injury. And it's, what's happening, it's a direct impact. And then what can be impacted by a SNP is your healing mechanisms post-injury. So there could be an indirect SNP. No worries. There could be an indirect SNP, but not one I can think of that's connected to that, since it's really trauma based.
Okay, excellent. I have one last question here. If there's multiple systems that are, there's another one just popped up. If there's multiple systems that are contributing to depression, right, or a mood disorder, is there one that you look at specifically first, such as insulin resistance, gut issues, autoimmune inflammation, or is it individualized for the patient? How do you tackle that?
That's a great question, and we can bring in Barbara Jans too, because it's about testing. So we can answer it all at one. Okay, so the first thing I do is I have a conversation with the patient, like what is their level of crisis, right? Are they at a level of crisis where we need to call 911 or we need to contract for safety? That can happen. Otherwise, 99% of the time, this is something that's making them feel miserable, but they've been living with it for a while. So the reason I ask those questions is not only for immediate information and is a phone call or a referral needed, but also because it lets you know the urgency. Like, do they need palliative relief right now? Like they need to throw a prescription at them and a holistic thing and a home device and TMS? Or do we have the luxury of being able to do some testing and get to root cause? In other words, could I give them some mood stasis, some pharma-GABA, some maybe if it's a hormone thing, DHEA, 5-HTP, and give them some relief while we look at what's really underneath it? And for a lot of people, the answer is yes, but I think that's an important first step, is to find that out. And then the next step is to, that medical interview is so important, right? We have quite a long questionnaire before we even talk to people that they fill out. So then the next thing is to find out what else is going on. Did they have food poisoning in the past? Did they have a head trauma? Were there childhood traumas? Did this happen right after pregnancy? Are they fine most of the month, but it's right before their period? So all of these things help you narrow down to what systems are contributing to their depression. And then once you know that, you start testing. And it's not that you're testing for depression, you're testing for mechanisms that can contribute to depression. So for example, if they had gained some weight recently, they're starting to feel grumpy, their mood was low, they're getting a little bit of constipation, their hair's falling out a bit, their skin's feeling a little dry, and they have all the classic signs of an underperforming thyroid. We can order a simple blood test. We do a much more full thyroid panel, but we can look at that. If they have some symptoms that make us think, estrogen or testosterone is out of balance, or maybe their cortisol's high, we'll order that test. If there's a circumstance where it seems like gut health, we'll order an advanced stool test. They could be in an allergenic state. They could be keeping themselves depressed and not realize it because they are eating food that they've eaten their whole life and they thought it was fine, but the inflammation is really impacting them. And so we need an allergy test. They could be histamine intolerant, where it doesn't matter what the food is. Their histamine is so high, their ability to break it down is so low, their digestion is so impaired that any food, they're having a histamine reaction. Maybe there's mold in their house. So being a functional medicine practitioner is really being a detective. And then once you figure that out and try to narrow it down, because we're always trying to make it as small as possible, because these tests typically are not covered by insurance, right? Some people can submit it and get reimbursed, or they use an HSA or an FSA, which is great. But otherwise, a lot of times you're just paying cash for a test. So we're trying to, what is it they really, really need? You gather that information, and then based on what they say and the results, you start putting together a plan. And if you're able to get one that encapsulates everything, beautiful. Otherwise, you triage it. What's the worst thing? And you start going after it and knocking things down one after another. And, you have to address all the root cause issues for depression. You have to address family dynamics. Depression, like ADHD, is a family illness. It impacts everyone. You have to address lifestyle and behavioral. And so you just, Shalise can tell you, every single person's different, right? I mean, it's just the nature of it. If we want to give just stamped care to someone, I would say, here's this little package, go get it, and that's it. And I never talk to anyone again, but we do it the hard way because you get better care. And that is really customized to each person based on who they are, what their body's doing, their test results, and how they feel visit to visit. So tougher medicine, but really what I think is the best. So I hope that helps. I know I couldn't give you an exact example, but we could always do a class and talk about case examples and just do one after another and show sample labs. So I do that for practitioners. Usually I think patients aren't that interested in it, but if it's something you're interested in, we be happy to do it. We do that in our office, by the way, all the time. We're a very unusual clinic that 4 times a week, every week, we have ongoing training for all our practitioners, and this is what we're doing, every day of the week. All right, thank you guys so much. Thank you.
Hey, Dr. Z, do you have I don't think the BLC reviews link was working. It erred. Do you have the real one?
Oh, let me see if I can find it real quick. Give me a second. Another way to get to it, if it's not working, is you can go to, you can just type in Body Love Cafe, like into Google, and it shows on the right, and you leave a review. So if you ever leave a review that you loved our class, that's so helpful for us, as a small business. It's just a cool thing. So certainly appreciate it. Thank you guys. Oh, appreciate it. And Shalise, thanks for doing tonight and being so awesome in the office.
You're very welcome. Nice to see some familiar names here.
All right, we'll send out the recording. If we get it out this week, great. Hopefully, fingers crossed, we do it. Otherwise, we'll send it out at the beginning of next week. It's a busy week because we're doing a lot of practitioner training also this week. So have a great night, and please share this information with your family and loved ones. The biggest take home point we want is that there's help out there, and we want people to get the help that they need. Okay, bye everyone.